record. Today we're going to talk about Chapter 10, the lymphatic system, the lymphatic system diseases and disorders. First, let's talk about the anatomy and physiology of the lymphatic system. The lymphatic system is formed by the lymph vessels that are ducts and that where the lymph is located, this fluid, and the nodes, the lymph nodes, the lymphatic nodes also are located in the lymphatic system. The lymphatic system protects the body from infection by filtering bacterial and non-bacterial products, prevents waste products from entering the circulatory system, and is dependent on the vascular system. The lymph is a clear fluid. Here you can see the lymph that is represented here in this part. So the lymph is kind of a parallel system of vessels to the circulatory system. For example, here you have a blood capillary where the blood travels inside here, but in a parallel way you have the lymphatic vessels here, and any waste product that comes out of the walls of the circulatory system then enters to the lymphatic system. That's the function, taking the waste product. Continuing with the anatomy and physiology, you have two divisions of the lymph system. You have the right lymphatic duct that drains the lymph from the upper torso and right arm. And you have the left lymphatic duct that is also known as thoracic duct, and is a duct also for the rest of the body, drains through this duct. Organs related to the lymph system are the tonsils in the throat, the thymus gland in the thorax, and the spleen. Common signs and symptoms of lymphatic system diseases are an enlarged lymph glands or nodes, fever, fatigue, and weight loss. The doctors can palpate the nodes, for example, in the area of the neck. When they are inflamed, they are swollen, they are bigger, you can feel them in the neck, for example, and even in other parts of the body, maybe the legs, the groins. Most diseases of the lymphatic system are related to diseases of other systems. Lymphocytosis is increase of white blood cells, and this is part of the symptoms of, or the signals of problems in the lymphatic system. Lymphocytopenia is a decrease of the white blood cells. For diagnostic tests, one test is the complete blood count, CBC, with differential, to measure regarding the lymphatic system, the white blood cells, the neutrophils, the eosinophils, basophils, macrophages. Also, another study is lymphangiography, that is an X-ray of lymph system after dye injection, MRI, CT scan, and a biopsy of the lymph nodes. Common diseases of the lymphatic system are lymphadenitis, is one of them. That is inflammation of the lymph glands. The symptoms are swelling, pain, tenderness in the lymph gland node, or both. The diagnosis is confirmed by biopsy. We were talking about lymphadenitis. Now let's talk about another disease related to the lymphatic system, that is the lymphangitis. Lymphangitis is swelling of the lymph vessels due to inflammation caused by streptococcus infections following trauma. It's characterized by red streak at bacterial entry extending to area of lymph node. Other symptoms are fever, chills, malaise. And cellulitis. For the diagnosis is immediate based on the high fever and the primary symptom of red streaks just below the skin surface. A blood culture can be completed to determine whether bacteria have entered the bloodstream. A biopsy can determine the type of bacteria causing the infection in the lymph vessels. For the treatment, lymphangitis is commonly treated with antibiotics. Warm, moist packs and elevation of the affected area are also helpful. For prevention, good hygiene and maintaining good general health are preventive activities of lymphangitis. For lymphedema is another disease of the lymphatic system that consists of abnormal collection of lymph fluid in extremities. The possible causes or etiology are surgery or radiation treatments, pregnancy, burns, trauma. Surgery or radiation treatment for cancer, especially breast and testicular surgeries. Breast cancer surgery, mastectomy, and radiation can lead to a chronic lymphedema of the arm on the affected side. About 30% of all post-mastectomy patients are affected by lymphedema. The surgery on blood vessels of the arms or legs is another surgery that can lead to lymphedema or collection of lymph fluid in extremities. Other surgical procedures such as liposuction too. Other causes such as pregnancy, burns, and trauma, as we mentioned before. The treatment for lymphedema is antibiotics, compression therapy, surgical intervention, depending on the cause. The treatment is dependent on the cause. Antibiotics might be needed to treat infections that worsen with lymphedema, placing the affected arm or leg above the heart level while resting. An exercise to increase lymph flow can decrease the edema. Procedures such as obtaining blood pressure and drawing blood samples should not be performed on the affected side because affected tissue is more prone to infection. Pregnancy and constrictive clothing often cause an increase in venous pressure, resulting in an accumulation of fluid in the ankles and feet. Decreasing venous pressure in these cases will relieve lymphedema. To reduce venous pressure in the pregnant female, lying on the left side help improve venous flow because the inferior vena cava is to the right of midline. Constrictive clothing should be removed or loose when lymphedema is observed. Compression therapy might be needed temporarily or lifelong, depending on the cause of the condition. Compression aids in pushing the excessive fluid back into the venous or lymphatic system. Compression also aids in venous or lymphatic system, in venous return or return flow of both the lymphatic and venous system. Compression gloves, arm wraps, and leg stocking are available for this purpose. Surgery might be needed to remove excess tissue if the affected limb becomes so large and heavy that it interferes with the ability to move and walk. For prevention of lymphedema, activities to reduce the risk of lymphedema including protecting the affected extremity, arm or leg, elevating the area while rest, avoiding heat directly on the area, avoiding tight clothing, and keeping the extremity clean to prevent infection. Another common disease on the lymphatic system is lymphoma. Lymphoma happens when neoplasms affecting lymphoid tissue affects normal lymphocyte production, leading to impaired immunity, and is the most common type of blood cancer in the United States. Lymphoma refers to several types of neoplasm that affect lymphoid tissue, lymph node, tonsils, spleen, and lymph fluid. There are many types of lymphoma, but all affect normal lymphocyte production, leading to an impaired immunity. Lymphoma is the most common type of blood cancer in the United States. Lymphoma is discussed in more detail in other chapters, like chapter 7, that is about blood and blood forming organs, diseases and disorders, under the heading Disorders of White Blood Cells. Another disease related to the lymphatic system is mononucleosis, that is a viral infection, somewhat contagious, also known as kissing disease. Mononucleosis is a viral infection that affects primarily children and young adults. It is somewhat contagious and is commonly called the kissing disease. The disease is discussed in more detail in chapter 20, Childhood Diseases and Disorders, under the heading Infectious Disease. Rare diseases related to the lymphatic system. The Kawasaki disease, also known as mucocutaneous lymph node syndrome, consists of an acute febrile disease that is found mostly in children. The symptoms are a rash similar to scarlet fever, edema of feet and hands, lethargy, congestion, and the treatment is supportive, just treating the symptoms, the fever, the pain, the hydration of the patient. So this disorder is an acute febrile disease found mostly in children, as we mentioned before, and causes cervical lymphadenopathy. It resembles the scarlet fever because the individual develops a rash and some edema of the hands and feet. Other symptoms include lethargy, congestion, irritability, fever, dry skin, and reddened lips, tongue and mucous membranes. The treatment again is supported because the disease does not respond to antibiotic therapy. This disease is rarely fatal in the acute state, but children can die quite suddenly some years later due to coronary artery disease, consequence of having the Kawasaki disease. Effects of aging in the lymphatic system. Well, you can get a decrease in the ability to produce antibodies, thus more prone to infections. increased susceptibility to autoimmune disorders, and impairment of vascular system also impacts the function of the lymphatic system. As the individual ages, there is decreased ability to produce antibodies, leading to decrease in the normal immune response, which interferes with the normal ability to ward off infections. If other chronic diseases are also present, the individual can be at an even higher risk for poor healing and development of infections. In addition, as the immune response becomes less effective, the individual is more susceptible to autoimmune disorders. Many diseases of the older adult have some direct relationship to the decrease in immune response. Because the lymphatic system depends for some of its function on the vascular system, additional problems arise in the older person who has impaired circulation or other vascular system diseases. The lymphatic system plays an important role in the body's ability to fight infection and maintaining immunity. The system is composed of lymph nodes, and vessels to transport the lymph. The lymphatic system also transports fluid that has leaked into the interstitial areas between the blood vessels. Diseases of the system are usually caused by infections or neoplasms and can range from mild to severe. Let's check a short video about the lymphatic system. Fatima Hamara, I put you present already. Well, let's see this short video, 2 minutes video about the lymphatic system, fats, function, and diseases to complement the PowerPoint.
I didn't realize how many mistakes I was making in English until I started to use Grammarly.
It's like having a proofreader and an English teacher.
Give me 1 second to show you something from the about the lymphatic system from a PowerPoint of my human biology class. Well, here you can see in detail the organs related to the lymphatic system, the tonsils that are the first line of defense against bacteria and other foreign agents, located in the throat. This one is the right lymphatic duct that drains the right upper portion of the body. This is the left one. The thymus gland, located in the behind the sternum bone, is the site where certain white blood cells acquire means to chemically recognize specific foreign invaders, like the T lymphocytes, become chemically specific for invaders. T lymphocytes are a type of white blood cell created in the bone marrow. Also, you have here this thoracic duct that brings lymph in this area, drains most of the body. Also, the spleen is another organ. It's the major site of antibody production, disposal site for all red blood cells and foreign debris. It's the site of red blood cell formation in the embryo. Here you can see some lymph vessels that the function is return the excess interstitial fluid and reclaimable solutes to the blood. Here, all these green dots are lymph nodes that filter bacteria and many other agents of disease from the lymph.
I'm sorry, Professor, I'm here.
No problem.
Me too, Professor. I'm here, Emanuela Pierre. I'm sorry.
All right. What's your name? Emanuela Pierre and Vicentia.
I'm Floyd.
Floyd and Emanuela Pierre. No problem. I will put you present in 1 minute. So, finally, the bone marrow is, in some bones, is production site for infection-fighting blood cells as well as red blood cells and platelets. So, all these form the lymphatic system. Here is a lymph node. The lymph trickle past arrays of lymphocytes in the lymph node. This is a valve that prevents backflow. This is a cross section of a lymph node. In the lymph node, bacteria are destroyed. Again, the functions of the lymph vascular system is functions in drainage, delivery, and disposal. Drainage channels that collect water and solutes that have leaked out of the blood, pick up fat absorbed from the small intestine and deliver them to bloodstream, transport foreign material and cellular debris to the lymph nodes. Well, just for the recording, this is everything about the lymphatic system disorders and diseases. Let me try to find another YouTube video that can be helpful also for the recording. Well, let's check this short one. 10 symptoms of lymphoma. Lymphoma is one of the lymphatic system diseases we check.
Optimum's best internet offer just got better. Get 300 meg internet now for only $35 a month, and we'll...
There is no screening test for lymphomas, so be aware of your body and inform your doctor if you feel any lumps or other symptoms. Lymphoma is a cancer of lymphocytes, which are infection-fighting cells of the body's lymphatic system. The lymphatic system is made up of organs all over the body that make and store cells that fight infection. When people have lymphoma, their lymphocytes become abnormal and grow out of control. These cells can travel to different parts of the body. Often, the abnormal cells collect in small, bean-shaped organs called lymph nodes. This causes the lymph nodes to swell. There are different types of lymphoma. Some types grow very slowly. Other types grow much faster. Sometimes, people start out with a slow-growing type of lymphoma that later becomes fast-growing. 1. The first sign of lymphoma is often one or more large swollen lymph nodes that can be felt under the skin, but are usually not painful. They are often in the neck, groin, armpit, or stomach. 2. Recurrent infections as your immune system becomes impaired. 3. Itching of the skin with or without rash. 4. Lymph nodes deeper in the body can also become swollen and cause symptoms. Lymphoma in lungs can cause cough or trouble breathing. 5. Lymphoma in stomach can cause abdominal discomfort, bloody stools, diarrhea or constipation. 6. Lymphoma in brain can cause headaches, forgetfulness, dizziness, or stroke-like symptoms with weakness or numbness in arms or legs. 7. Fatigue. 8. Fever. 9. Weight loss. And 10. Night sweats that soak your clothes. All of these symptoms can also be caused by conditions that are not lymphoma. But if you have these symptoms, you should let your doctor or nurse know. There is no screening test for lymphomas, so be aware of your body and inform your doctor if you feel any lumps or other symptoms. Diagnostic tests include lymph node biopsy. The doctor will remove all or part of the swollen lymph node. Bone marrow biopsy, CT scan, PET scan, or other imaging tests. Treatment will depend on the stage and type of lymphoma and your age and other health problems. People with some forms of lymphoma get treated right away. But people with lymphoma that is growing slowly and not causing symptoms often do not need treatment at first. Treatment can include chemotherapy, immunotherapy, radiation therapy, and bone marrow transplant, also called stem cell transplant. This treatment replaces cells in the bone marrow that are killed by chemotherapy or radiation. It's important to talk to your doctor about any side effects or problems you have during treatment. Thank you for listening. Please like and subscribe to Diseases Simplified for more health tips.
Well, I'm gonna stop the recording now.